Liza's given me the 5-minute nudge. So my role today as a discussant is to try and summarise what we've been talking about in the educational arena both yesterday and today, because after this we'll be moving into policy. So I've tried to sort of capture the larger areas that we've been focusing on and in preparation for our discussion time after my presentation. So we've talked a lot about silos, and we know that that's kind of a hallmark of traditional academic system. It's definitely a negative, and there's been efforts to try and change that for a long time. What I think is very important in terms of our topic, non-pharm interventions for pain management, is getting more participation from the social scientists and the psychologists, and especially in the realm of social determinants of health. So we've been really focusing on interprofessional education. We've talked about didactic approaches, and we've also talked about immersion approaches. And I think everyone would agree that the immersion approaches by far make the most compelling argument for effectiveness and bringing people together. And I did mention I'm from New Jersey, so I thought I'd put in a little quote from Chris Christie, who said that it's very hard to hate people face to face. So I think that makes a good argument for immersion. Another thing that's come up is, particularly in relation to the complementary therapies that have been around for thousands of years, and we haven't really talked much about this, but paradigm and epistemological differences are very significant. My background is Chinese medicine, and I'll reference in a moment just how important that is for Chinese medicine practitioners. How do we sell this to different professions? We need probably to have different strategies for the different professions to bring them on board with IPE. It's also not just telling the various professions about what they do, it's also telling them about training and qualifications. So when I give a talk about Chinese medicine, I always talk about how much training is involved, national licensing exams, certification, state licensing, obviously for choosing a practitioner, but also it often engenders much more legitimacy. So we need to focus on conveying information at that level as well. And then lastly, interprofessional, we haven't talked about this a lot either, but we have this smorgasbord of different treatments, how do we educate patients to make choices for themselves? And as much as it's really positive that different therapeutic interventions are being brought into the healthcare arena, it's making things much more complex for patients, even highly educated patients, much less patients with lower levels of education where it's obviously more challenging. So we've talked a lot about self-care. We've talked about how it should be occurring at all levels of the education system, right from primary school all the way through. We've been talking about medical provider burnout and teaching medical providers how to take care of themselves and be a role model for what they're telling their patients to do, so walking the talk. And then we've talked about trying to educate patients in self-care, and we haven't really talked much about developing programs. And one example that is from my own background is the education programs that we give to couples and individuals who are undergoing in vitro fertilization. So all fertility centres have education programs that these patients must do before they can start their IVF cycle. So we need to develop that in other arenas of healthcare. So Ben mentioned my background in working on the research literacy issue for complementary and integrated healthcare practitioners. One of the challenges I encountered is how do you get those practitioners to be enthusiastic about the research? And there's a lot of reasons why they wouldn't be. We've talked a little bit about the inappropriateness of the methodology, particularly for testing complex interventions like Chinese medicine. One of the ways that I had a lot of success was being honest with them and saying, look, a lot of that research out there is not going to tell you how to treat your patient. It's not necessarily clinically relevant. It serves the purpose of legitimizing that particular intervention, and it provides evidence to open doors and get it into other arenas. But is it really going to inform your practice? Probably not. But you could use it to legitimize yourself. You could use it to build your business, create referral networks, practice building talks. There are many ways in which you can use the research. So I think we have to find creative ways of getting the complementary and integrated healthcare professionals on board. Hopefully the research will become more clinically relevant to them going forward, especially as we engage in pragmatic research models. I think that it will get better. But in the short term, I think that's a significant challenge. I want to also mention, and something we haven't talked about, is education for biomedical healthcare providers and this whole issue of basically data overload. So I've read recently that medical information doubles every 3 months these days. So if you take a physician, by the time they've gone through their training, that information has doubled 60 times. So how do we deal with this? How do we build that complexity and changeability into the curriculum? And what really comes to my mind is, look, gone are the days where medical providers are going to know everything. It's just not possible. But how can we provide information to clinicians real time so that they can make appropriate decisions for their patients? So that sort of brings me into the realm of big data, telemedicine, artificial intelligence, which another area that is huge for education that we also haven't talked about. So obviously that involves, electronic health records. There's so many problems with that in terms of different systems not talking to each other. How do we convert that into information in real time for clinicians? What is the role of telemedicine, artificial intelligence monitors that patients will wear in patient care? We know that that has to play a huge role in the management of chronic conditions in community-based healthcare settings going forward. How do we bring the clinicians and the patients on board? So clearly what should be part of our conversation when we talk about IPE is we need to bring in the engineers and the tech folks as well. Learning medical systems. So this is a whole new arena, using the electronic health records, doing big data analysis. What's that telling us in terms of predictive factors for patients before things even happen to them? And this helps us to address hospital readmission rates. It improves the outcomes for value-based healthcare reimbursement, which I know we're all kind of in denial, but that is coming down the track. So that's a whole nother area of education that we need to focus on. But the last thing I want to talk about is compassion. So we've talked about, we know medical students go through their training and become less compassionate. People say that it is possible to teach compassion. One example I'd like to use and leave you with is from Chinese medicine. Where this is from Ted Kapchuk. There are 3 levels of Chinese medicine practitioners. The first level is kind of the technician who can put the needles in the appropriate spots. The second is the person who can do more sophisticated diagnosis and better integrate all the different things that Chinese medicine practitioners do, cupping, gua sha, bloodletting, herbal medicine, acupuncture, medical massage. It's not just acupuncture. But thirdly, and most importantly, is the practitioner who can engage in what we call the divine penetrating illumination. And this is the person that merely sits with the patient and holds space. And I think where that comes from is compassion. So where I want to leave you is that actually healing is relatively simple if you really are committed and dedicated to that and can really identify with the patient's suffering. And I think that's something that we all need to think more deeply about.
Thank you both. Great.